So let's talk about evaluation for prostatitis. Well, you come in, you sit in this chair, and I sit next to you, and we just chat. Everybody's dressed, and I'm collecting your information. I want to know how it started. I want to know who you are, what you do, what your hobbies, what is your stress level, how do you live your life, what do you eat, how do you sleep, all of it. I need to know you as one giant unit. Yes, you came to me for prostate, but I need to know all of you, up and down, anatomically, physiologically, social, economically, emotionally, because that's the only way to tackle this little lymphatic organ. So I collect information, and my brain is now going in very different directions, right? I never practice inside this little box. You will get to know me. I don't have a box. I have a tree. So every branch is talking to me. So he has testicular pain, he has erectile pain, he has a little bit of ED, he also has maybe potential IBS, he's a terrible sleeper, he is type A personality, super successful, has a relationship, takes care of parents, like all of this is coming, right? And he loves to do his abdominal work. He's just on this abdominal roll all day, every day. And I have to keep in mind of who you are and what you do. So after I do that, I start to treat you as a person orthopedically. I look at your diaphragm and I probably will say to you, see how tight your diaphragm is? And you'll go, oh, yeah. I'll go through your lumbar spine and I'll say, see how tight it is? And guess what you're gonna say? Oh, yeah. See how tight your hips are? And your abdomen, especially your rectus abdominis, the six-pack muscle, is full of trigger points all the way into your pubic bone. Into your pubic bone. And guess what's underneath it? All of this, right? So I explain to you also, when it comes to connective tissue, what happens in the shaft, what happens in the testicles, because it's all continuation up the abdomen and down into the pelvic floor and up the back. So during the evaluation, I will find where your dysfunction is. And you're like, yeah, but let's talk about prostate. There's a problem with the prostate. But my explanation to you would be, true, there's a problem with the prostate, but I need to clean up all of the neighborhoods around the prostate, and not just here, right? Not just immediate neighborhood around the prostate. I have to go as high as your diaphragm, your lumbar spine, your hips, your thighs, down to your legs, just to address the little walnut-sized prostate. Because I need to know that there is no strain, there is no compression, your lymphatics is draining, you're not tilting your pelvis and putting strain on the front versus the back. I need to fix your urination issues, I need to fix your defecation issues, I need to fix your digestion issues, I need to make sure that orthopedically you're sleeping in the proper position, at work standing or sitting in the proper position, that your toileting is proper position, because our goal is to decompress that little organ prostate, that all the muscles move away from it, and the bladder, right, and the colon. So all of it starts to actually flow, and you decompress the prostate, and the pressure and the pain will go.